Hi, I'm Dr. Madsen. Today we're going to be talking about population health for nurses. We're following the OpenStax textbook, and we're going to be summarizing Chapter 4, which is the health of the population. What we're going to cover, we're going to define health, look at performance metrics, define health in America, evaluate the World Health Statistics or have that conversation as to know what to look for, and talk about global public health safety. By the end of this section, you should be able to talk about the different meanings of health and formulate a definition and really explain the purpose of measuring health outcomes in a population. The World Health Organization, they define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Social determinants of health, these are the conditions in the environment where people are born and live, they learn, work, play, worship, and age. And that really has an effect on a wide range of health and functioning. And we can think of this as the quality of life and those associated outcomes and risks. So what does it mean to be healthy? Think first of your own definition, and then let's talk about this. So those who perceive health as a complete physical well-being may see themselves as unhealthy if they develop a chronic illness. So we can think of someone who maybe didn't have a chronic illness their whole life and then developed, let's say, metabolic syndrome, and now they see themselves as unhealthy. Or if this is not their perception, perhaps they have a chronic disease like asthma, but they perceive themselves as healthy. And that would be more of a holistic view. So holistic view is thinking that perception of health even with a chronic condition. When we talk about well-being, this is very subjective. Again, it's the perception of an individual that life is going well. And when we talk about health-related quality of life, this is the perceived physical and mental well-being of an individual or population. This can be measured using a variety of surveys and scales, and we want to measure this so that we as nurse researchers, public health nurses, can be able to collect this data. And in knowing how people define health, then we can work together to achieve it. First, we have to have that foundational understanding that when we're all talking about health, we're defining the same thing. So a change in health status of an individual, group, or population is tied to an intervention or series of interventions. So population health outcomes, these look at broad topics. So we can think of this related to a target population, for example, mortality rates. So if we're thinking of mortality rates and we're talking about health outcomes, we could talk about that in terms of cancers like lung cancers, or we could talk about this in maternal mortality rates. We're saying how many people are dying during childbirth. So it's important to look at these rates, look at the health outcomes in our country, and start to be able to define health based on that. So now you're going to look at the purpose of health indicators, and you should be able to explain those by the end of this section, and also what different approaches are there to measure population health outcomes, and these different and various types of health statuses, and then overall, what is the nurse's role? So when we think about performance metrics and we're talking about health indicators, what we're saying is these are health-related measures of data, and it's referring to a health status. So for example, when we talk about years of life lost, this is measuring premature mortality, considering the frequency of death and age at which it occurs. And then years of healthy life lost due to a disability, here we're talking about the number of years lost because of an onset of disability or illness. And when we talk about disability adjusted life years, this would be the sum of both the years of life lost and years of life lost due to a disability. And we look at the sum of this attributable to a disease. And then each DALY, so that's that disability adjusted life year, each of those represents 1 year of life lost. And we use these indicators when we're looking at research as public health nurses because we can measure mortality rates, and that's important to see how many people are dying in our population due to a disease, but how many people are living with this disease and how is that impacting their quality of life, other life metrics, their ability to work and provide for their family. And that's what we're looking at really when we're measuring these daily. And then that quality of adjusted life years. So we're thinking of this in terms of months or years of reasonable quality an individual can gain through treatment. So now it's the opposite. If they get treatment, how can they gain some of that back? So when we think about outcomes, we're looking at life expectancy at birth, so overall mortality level or average age of death. In morbidity and mortality, this is measuring the progression and severity of a given health event. When we talk about morbidity, this is the state of being symptomatic due to disease prevalence. So it's the overall amount of disease. And this is measured in proportion to a population that has a disease or condition over time. Incidence is the number of new cases of that disease within a year. And then mortality is really looking at the number of deaths in a time frame. When we think of burden of disease, this is the measure of both of these indicators together. And when we think of the summary measures of a population health, this is combining data from basic metrics to represent health in a single number. So here is a graph of the burden of disease caused, and this is looking at it in the world. So here you can look at and see the total disease burden, and this is measured in disability adjusted life years by subcategory of disease or injury. So DALY is really measuring the burden of disease from both years of life lost due to premature death and years lived with a disability. And like we said, that one DALY equals 1 year of life lost. And then you can see here on the left, we're looking down in terms of what it is. So cardiovascular disease, cancer, neonatal disorders, all the way down to natural disasters. And then across, you can see the amount of people impacted. So key health indicators are based on subjective data. So when we're talking about this behavioral risk factor, and this is used in research, and again, public health nurses are using this research then to make changes within the communities and on policy levels. The first step is really being able to collect this and publish it and then move forward from it. So this behavioral risk factor surveillance system is a health-related telephone survey, and data can be obtained from this. And then the National Health and Nutrition Examination Survey. This combines both interviews and physical examination to assess nutritional health. And the National Health Interview Survey is the oldest ongoing health survey in the United States. The health-related quality of life, this is a CDC survey using a subset of questions called healthy day measures. So I invite you to look up studies where these are used and then see what impacts they've had on population health and where community health and public health nurses, whether they're in the county, in the school, or doing research, are making changes and impacting on these through these different surveys. So the nurse's role, nurses are very well positioned to identify patterns across populations. This makes sense for how we're trained and also for the amount of time that we spend with our patients typically. And nurses really need to understand these basic health metrics and population health outcomes and key health indicators so that we can tailor our education, our intervention, all of the resources, and advocate for change. We can improve health in the population at large as well. Now, when we look at this specifically health in America, by the end of this, you should be able to identify what the priorities are in the United States, look at the leading causes of death, describe trends in mortality due to most common infections and chronic diseases, and compare outcomes from different income level countries and discuss the nurse's role. So you guys should be becoming familiar with Healthy People 2030. This is in the United States. The mission of this organization is to support the nation's efforts to improve health and well-being and promote equitable access across healthcare and health promotion, and to create a healthy physical, social, economic environment and effective policies. So basically all of that is saying there are key measures and metrics. You guys can go online and see what those are. These are goals. We're collecting data. We're putting out research programs. These are in schools and the county, and we're trying to increase and support health for the population based on what is identified in these goals. So here you can see these objective goals and measures with the overall mission of Healthy People 2030. And then they have these core objectives and leading health indicators, and you can see if those are being met or not met. Then the developmental objectives, those objectives we're gathering more data on. So we need more data in order to understand really how to formulate that objective, or if it's being met or not met or developing. And then there are these research objectives. So public health issues that are not yet really associated with evidence-based intervention. So we need more research in these areas to develop those interventions. So the leading causes of death, this is based on the National Center for Health Statistics, and 1 through 10, you can see heart disease, cancer, COVID-19, accidents. So these would be your unintentional injuries, stroke, chronic lower respiratory disease, Alzheimer's, diabetes, chronic liver, and kidney. So, and kidney disease. So you can see these and then be thinking about how this compares to both a local, where you are working, living locally, and why are these the key indicators? Always ask the why. So when we're looking at this graph here, what you're looking at is age-adjusted death rates and life expectancy in both the United States. So over the past century, life expectancy has increased and rates of death have decreased. The 20th century saw really an unprecedented decline in mortality, and life expectancy rose more than 30 years during this time frame. So infectious diseases were the leading cause of death in the early 1900s, and then when there was improvements in sanitation and nutrition and the development of antibiotics, this led to a sharp decline in deaths from infectious disease. From that point, we saw chronic disease emerge as a primary cause of mortality, and then following decades of increases in life expectancy in the United States, this is now starting to fall again. So infectious diseases do remain a public health threat. We've seen all of this through COVID-19. Americans of all ages are at risk from mortality from infectious disease. We can see this in other ways, such as bacterial sepsis in newborns or influenza and pneumonia from people 1 year through adulthood. In terms of chronic disease, this is defined as a condition that's present for more than 1 year and requires medical intervention. 6 out of 10 Americans have one chronic disease, and 4 in 10 have 2 or more chronic diseases. Some major chronic diseases are heart disease, stroke, diabetes, and cancer. And chronic disease accounts for the most healthcare costs in the United States. When we look at mortality trends in suicide and drug overdose, suicide is death caused by self-directed from an injurious behavior, so this intent to die. The rates increased by 37% between the years 2000 and 2018, and then decreased by 5% between 2018 and 2020. Research says that this increased suicide rate is correlated with increase in mood and affective disorders and are associated with alcohol and drug abuse. More research has been coming out about increasing rates again of suicide, and there is more research that's looking at social media usage and mental health as well. And then drug overdose can be intentional or unintentional. In the United States, there is currently an opioid overdose epidemic. When we think about maternal mortality, we have to define our terms. So pregnancy-associated death are those occurring during pregnancy or within a year after pregnancy, whatever the cause. There's actually a lot of pregnancy-related death with that outside that year. There's a lot of research that is needed and a very big lack of understanding of programs that need to be researched and implemented to help this population. So pregnancy-related deaths occur either during pregnancy or within a year after the end of pregnancy from a pregnancy-related condition. Maternal mortality refers to deaths that occur while pregnant or within 42 days after the end of pregnancy from a cause that was aggregated by the pregnancy or its management. So maternal mortality rates in the United States exceed that of other high-income countries and is growing. And then when we look at infant mortality rate, this refers to an infant's death before their first birthday. And the U.S. rate exceeds that of peer countries. This could be partially due to the medical interventions that allow premature babies to be born early, which is great, but then their survival rate, we need to be having targeted interventions in that pocket. So we really invite you guys to look up the research in all of these areas. It's very important. And then infants born to Black people in the United States are at higher risk for mortality than those born to white people. Healthcare disparities. There are a lot of things that contribute to this. We know that race, ethnicity, sexual orientation, age, socioeconomic status, and geographic location are factors. And these can be partially due to lack of insurance, transportation, cultural differences, and differences between providers and patients or clients. We're looking at health trends in the United States. Positive things that we're seeing is that heart rate rates are decreasing. Percentage of children with asthma, that's declining. Cigarette smoking declined from 20.6% in 2019 to 14.2% in 2019, but we do need to evaluate the research in vaping. And then uninsured Americans under 65, that has decreased, although it's still at 12%. Also, delay in seeking medical care, that rate has also been decreasing. In terms of negative trends, things that we see are that rural residents are at greater risk for poor health than urban counterparts. Many indicator measurements are worse in rural areas versus urban areas. Suicide rates have increased in almost every state over the last 2 decades. When we're comparing between the United States and other high-income countries, we spend more on healthcare and medical technology in the United States than any other high-income country. But in the United States, we have poor health outcomes and the lowest life expectancy compared to these peer countries. Things that could be contributing would be low supply of physicians, low incidence of chronic diseases, or high incidence, of chronic diseases, high incidence of obesity rates. This is twice that of the average peer country. So what's the nurse's role? Nurses have a professional and moral responsibility to address these issues. We are uniquely qualified to do so because we can navigate this healthcare system. So nurses can work as case managers, researchers. They work in schools, they're in the hospitals. They have the ability to translate this information in a way that people can understand. They have the resources in terms of knowing what to refer to, and a responsibility to advocate for policies that improve access to healthcare for Americans. By this point, now you guys should be able to, by the end of this next section, talk about the Sustainable Development Goals, the global burden of disease, examine these global disease estimates and understand health challenges, and understand how health intersects with global health, and look at the nurse's role. Sustainable Development Goals SDGs are a 15-year plan with 17 interlocking goals, and these are a call for action. They address poverty, inequality, climate change, peace, and justice. These goals are aimed at all countries, including those that are developed and those that are developing. They're organized into 5 categories. So these 5 categories include people, planet, prosperity, peace, and partnerships. When we're looking at these global health priorities, global burdens of disease, this is a resource that studies changing healthcare needs and challenges worldwide in the 21st century. So if we look at key findings in 2019, the health of the world's population, and we look at life expectancy, we see it's increasing. There is an urgent action needed to address concerns about chronic disease, risk factors, and trends, especially when we look at maternal and child health. We look at impacts of COVID-19, including both short and long-term health risk, and then also the relationship between climate change and health. So the top global priorities are cardiovascular disease, diabetes, cancer, and malaria. So here what you're looking at is a picture looking at the U.S. Army medical researchers taking place in World Malaria Day. This is from 2010, and we can see in this picture research that is happening and interventions to prevent or limit the spread of malaria. So now we're going to be talking about how global disease estimates support challenges. So this is important. It's a very particular component of looking at health priorities worldwide, and it looks at all of the mortality and disability throughout the world, specifically the prevalence and relative harm that certain conditions cause. So this intersection of health in America with global health, the United States has emerged and engaged in global health activities for over a century. It contributes to more funds internationally, and this would be historically, so we need to reevaluate this in terms of our current climate, but health programs in any other country. And it also protects health. This also protects the health and well-being of Americans. So health and safety of countries worldwide are really more closely linked than ever before. Countries need to identify and share best practices, so we can look to the UK, for example, and see what they're doing in terms of birthing outcomes. And by sharing this information and comparing this, we're able to strengthen global health and human services. There are several international nursing conferences that get together and look at education and research, and researchers get to present and share ideas and hear what other countries are doing and start to make those connections. And this allows us to then even talk more about this. So we have a professional obligation to understand global health as nurses and to know what these healthcare priorities are. This is important when understanding the SDGs and also where these priorities are coming from. We need to be able to promote and improve health outcomes through research, engagement in communities, and through connections to the healthcare institutions and community partners. So next, by the end of this next section, you should be able to define global health security, describe interventions used to promote public health security, and look at this interconnection of population across borders, and from all of this, think about the nurse's role. So global health security risks, emergence and spread of new infectious diseases, we saw this with COVID-19, really show how this is a security risk and how it impacts health of our communities. The ability of diseases to spread globally is faster than ever before because more people are traveling. They have access to be able to travel more now than they ever had, in addition to trade. And then we also see there's an increase in drug-resistant disease causing pathogens. We can think about this in terms of TB. There could be a risk of accidental release, theft, or unlawful use of dangerous pathogens. So there has to be an awareness of that within our communities. The Global Health Security Agenda is an effort of more than 70 countries to protect the world from infectious disease threats. So the surveillance system, this is used to identify risk and quickly detect and stop outbreaks of infectious diseases. The laboratory systems are used for detection of pathogens, and the emergency management and response. This is an important public health security intervention. And when we look at workforce development, we look at this in terms of every country should have a really well-trained, highly skilled team to investigate potential outbreaks and intervene quickly. And the CDC has established the Field Epidemiology Training Program to train what they call disease detectives. So this interconnectedness of population health, when we think about Ebola, the first outbreak occurred in 1976 in the Democratic Republic of the Congo near the Ebola River, and more than 20 outbreaks happened in 18 countries. Tuberculosis is found in every country in the world and affects all age groups. It's the second leading cause of infectious death worldwide, and there are multiple drug-resistant TB strands that are very easily transmitted. The human immunodeficiency virus, HIV, first was reported in 1981, and it was a major global health issue. So the ongoing transmission of HIV with increasing transmission reported in some countries is still occurring. And in 2022, 40 million people were reported to be living with HIV. Nurses have a vital role with active participation in global public health security. This includes writing, updating, reviewing, and exercising emergency response plans. In addition to collaboration, working on the county level, working on a policy level, working on a research level. Nurses may be required to dispense vaccine, antimicrobials, or antitoxins, or obtain other resources from the HHS Strategic National Stockpile. And we can see also the role that the nurses had with COVID-19 in the acute care setting as well as the public health setting. And nurses may be asked to assist in shelters and schools or places with vulnerable populations, and not only in terms of physical support, but psychological support for those who are experiencing trauma if it were in relationship to, for example, a bioterroristic event. So in summary, we defined public health and community health nursing, looking at physical, mental, and social well-being and the nurse's role in that. We also looked at this interprofessional team and thinking about the nurse's role in policy, partner, and community, and addressing both communicable and non-communicable diseases through assessment, intervention, and response. Thank you.